All right, this morning, Consumer Confidential. We're gonna talk about caregiving. This isn't something we always talk about a lot here, but we're gonna talk about caregiving because it can be draining emotionally, but it can also be draining financially. In fact, a recent AARP report found that 38 million Americans are spending a full quarter of their annual income on caregiving costs. So we brought in CNBC senior personal finance correspondent Sharon Epperson. She's here to share some ways to ease the burden. So we're not going to talk about the emotional aspect of it this morning, but let's talk about the financial aspect. You maintain the best thing to do is start early.
It's really important to start early, and you can't take the emotion out of it, Craig. I mean, it's important to start early by talking about the situation and how you're going to pay for it. Long-term care insurance, that is probably one of the best ways to be able to pay for long-term care, but it's expensive. It could be thousands of dollars a year in premiums, and a lot of people don't have it yet, and they're in an emergency situation where they need it or they can't afford it.
And the older you get, the more expensive it becomes.
Exactly. So the important thing to do is have that talk about who is going to do what when your loved one cannot do that. So the legal documents that allow you to do that, the health care proxy, the power of attorney, very, very important. You want to have a blueprint of what is going to happen if your loved one needs care, who is going to take care of them, where they're going to be. Have that conversation before you need to have it happen.
Is there a certain age where you should be having those conversations? Or?
I mean, I think this is a multi-generational issue, and so it should be talked about all along the way.
I did not fully appreciate there were so many nonprofit organizations and government agencies that were providing help.
Well, there are, and so it's important to check with your state about your state Medicaid program if you qualify for that. If you're a family caregiver, you could get financial assistance. If you're a veteran, you could get financial assistance for your family caregiver. There's also, though, a lot of people who aren't going to be able to do that, and so getting someone to help, getting respite care is very, very important. And then also looking into what other government and health benefits might be available, what disability programs are out there, specifically for certain diseases. Nonprofit organizations may be working with you for that.
You got to look.
Yeah, you got to look.
So, Sharon, a lot of folks may not know, I wasn't aware of this, that there are some tax benefits that you can tap into to help with this.
For a lot of family caregivers, they're providing financial support for their loved one, at least, if not all year, half of the year. And if so, they may qualify to have that person as their dependent. If that happens, you can qualify for some medical expense deductions on your tax return. If you're making $40,000 a year, anything above $3,000 could be written off in terms of medical expenses. And I talked to a family who spent $5,000 on a hospital bed in their home for their loved one, so that could be written off. Dependent care tax credit is another possible tax credit. You can go to irs.gov to see if you qualify for that, but that could be a percentage of up to $3,000 in qualified expenses.
Oh, wow. And then also there's your employer. There may be benefits there.
That is the best thing to do, is make sure you know what your employee benefits are. If you can contribute to a health savings account, you have a high deductible health care plan, you can use that health savings account to put away money to then spend on those types of things for your loved one. Flexible spending accounts is another way that you can do that, either a health flexible spending account or a dependent care flexible spending account. Paid time off, remote work, we take it for granted, but when you're caring for someone, you need that.
And the emotional part of it.
The emotional part, again, you can't separate the emotion from the finances, and so an employee assistance program that your employer may offer could be very important.
All right, really quickly, I didn't know that there was such thing. There are people who specialize in this field. They're managers, care managers.
So they're nurses, they're social workers, and they now specialize in being care managers and helping you figure out where, if I want to have my loved one in a senior facility, what's the best one? What type of services should I get? How do I create a plan for my loved one as they're needing care? Because I don't necessarily know how long, but I want to make sure that I'm providing the right type of care at the right time. It can be about $125 an hour. That's a lot of money, but some people say that saves you the emotional stress.
I think the bottom line is there is support.
There is support.
And you don't have to go through this alone, because it can be very isolating.
That was so much useful information there.
Thank you.
We encourage folks to go back and watch it on our website as well. There's more information about managing those caregiving costs. Again, it's today.com. Thank you, Sharon.
Absolutely.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.